Hi, my name's Ariel Causey. I'm a family nurse practitioner, and I got into integrative medicine about 15 years ago when I started my first job. I actually worked with a chiropractor, massage therapist, and acupuncturist, and started working with them and learning the ins and outs of nutritional supplementation and how to start working at the root cause of disease and illness. And then later on in my life, I decided I was going to go to school to be in some healthcare setting. Went into pre-med and then decided to go into nursing since they had some pretty deep roots in complementary and alternative therapies, and that seemed to be where my predominant focus was in helping patients using as few medications as possible. For new practitioners getting into integrative and functional medicine, it really is a whole new world, and it's a lot of information to really take in. A lot of practice with nursing school or other fields of healthcare information and education tend to focus on correcting an issue in a certain organ system and not necessarily always looking at the bigger picture or looking for connections between let's say the gut and the brain, or how the diet may be affecting the patient's health status in a very major way, and kind of compounding some of their issues. So it's really about learning some of the basics and really having a good understanding of the biochemistry of a patient, and then moving forward you can start incorporating other things like supplementation and other practices to really start expanding your information and how you help patients get better and well. So when I went to nursing school, I felt that there was a large lack of information in terms of nutrition and how to actually make the body well again. That can include supplementation, meditation, prayer, bioenergetics, massage, acupuncture. And so there's a large variety of things that you're not taught in nursing school or in medical school either, that would give you a good basis and foundation in terms of where you would need to go in a functional medicine or integrative practice to make your patient as well as possible. I feel that a lot of medications for the most part are more of band-aids and don't actually solve any of the problems. So in order to start solving problems for patients, we need to be able to help them in the best way possible. And so I needed to fill in those gaps myself by educating myself in a lot of those arenas, and then pairing together with other people who have been in functional medicine, integrative medicine for longer periods of time to help guide me. The benefits of working with ACAM and the Academy program is that we're going to start to be able to provide that without necessarily having to have a direct mentor on hand. You can start learning some of these lessons through some interactive workshops online, and then our annual conference is going to start to cater to educating those who are newer into the field or thinking about getting started in the field of integrative and functional medicine, so that they would have a foundation, that they don't have to do as much self-taught knowledge, and that this can have more research-based applications, and that's what we'll be presenting on through the workshops online and through the national annual conference.